Headaches after 60 are often misunderstood, dismissed as simple signs of aging or temporary discomfort. Yet in reality, they are among the body's earliest and most honest signals that circulation and nervous system balance are beginning to change. As the years pass, blood vessels naturally lose some of their youthful elasticity, becoming slightly stiffer and slower to respond to changes in demand. This alone is not dangerous, but when combined with long periods of sitting, reduced daily movement, shallow breathing, and accumulated stress, it creates an internal environment where blood flow to the brain becomes less efficient. The brain, which depends on a constant and finely regulated supply of oxygen and nutrients, responds to even minor disruptions with discomfort, pressure, or pain, not as a failure, but as a protective alert meant to draw attention before more serious damage can occur. Many older adults reach for pain relievers when a headache appears, silencing the signal without addressing its source. While this may bring temporary relief, it teaches the body that its warnings are being ignored. Over time, the underlying issues remain, and in some cases quietly worsen. Reduced circulation in the small vessels of the brain increases vascular resistance, meaning the heart must work harder to push blood upward. This extra pressure can show up as recurring headaches, dizziness, or heaviness in the head, all of which are early indicators that the vascular system is under strain. When this strain persists unchecked for years, it increases the likelihood of serious events such as stroke, not suddenly, but through slow and progressive imbalance. The nervous system plays an equally important role in this process. Chronic stress, emotional tension, and unresolved anxiety keep the body in a constant state of alert. This state causes blood vessels to remain slightly constricted even at rest, limiting circulation and elevating baseline blood pressure. Headaches become the language through which the nervous system expresses overload. They are not random occurrences, but reflections of a system that has lost its ability to return to calm efficiently. Recognizing this changes the relationship one has with pain, shifting it from something to fear or suppress into something to understand and respond to with care. When headaches are seen through this lens, they become an opportunity rather than a threat. They invite a return to fundamental biological principles: movement to encourage flow, breath to regulate pressure, and awareness to calm the nervous system. Addressing these root causes restores balance gradually and safely, especially in aging bodies that no longer respond well to aggressive interventions. Instead of masking symptoms, this approach honors the intelligence of the body and supports long-term brain and vascular health by working with natural physiology rather than against it. A gentle 4-minute daily exercise may seem almost insignificant in a world that glorifies intensity and exhaustion, yet for the aging body, it represents a precise and intelligent intervention that aligns with how human physiology truly works. After 60, the cardiovascular system benefits less from sudden exertion and more from rhythmic, controlled stimulation that encourages blood vessels to adapt without stress. The purpose of this brief exercise is not to challenge endurance or strength, but to restore circulation patterns that have gradually weakened due to years of reduced movement and prolonged sitting. By engaging the body in a calm, deliberate way, circulation improves steadily, allowing oxygen-rich blood to reach the brain without sharp increases in heart rate or blood pressure. The foundation of this exercise lies in activating the large muscle groups of the lower body. The legs contain a vast network of veins and muscles that assists the heart in returning blood upward against gravity. When these muscles remain inactive for long periods, blood tends to pool in the lower extremities, forcing the heart and neck vessels to compensate. This compensation can increase pressure in the head and contribute to headaches. Gentle leg movements such as slow marching or subtle knee bends create a pumping action that supports circulation naturally. As blood flow becomes more evenly distributed, pressure in the upper body begins to normalize, relieving strain on the vessels that supply the brain. Breathing is woven into this movement with equal importance. Slow nasal breathing that expands the abdomen rather than the chest activates the parasympathetic nervous system, which signals the body to relax and lower blood pressure. This coordination of breath and movement creates a powerful regulatory effect. The heart responds by beating more efficiently, and blood vessels soften rather than constrict. In older adults, this effect is crucial because it reduces the risk associated with abrupt cardiovascular changes while still improving overall blood flow. Another key element of this exercise is its effect on vascular flexibility. Blood vessels are living tissues that respond to how they are used. Gentle, repeated increases in circulation teach them to expand and contract smoothly again, improving endothelial function and reducing chronic stiffness. Over time, this adaptability lowers baseline blood pressure and decreases the likelihood of sudden pressure spikes that can trigger headaches or contribute to stroke risk. The body learns to move blood with less resistance, conserving energy and protecting delicate cerebral vessels. Perhaps most importantly, the simplicity of a 4-minute routine encourages consistency. The body responds more favorably to daily moderate signals than to occasional intense efforts. When practiced regularly, this exercise becomes a reliable cue for the cardiovascular and nervous systems to reset. It reinforces a sense of safety within the body, reduces chronic tension, and supports long-term brain health through small, faithful actions that compound quietly over time. Posture is often treated as a matter of appearance or comfort. Yet, within the aging body, it becomes a powerful determinant of circulation, nerve function, and brain health. Over decades, subtle habits accumulate as the head drifts forward, the shoulders round inward, and the upper spine collapses slightly under the weight of gravity and daily stress. This gradual compression narrows the spaces through which blood vessels and nerves travel from the heart to the brain. The arteries that supply oxygen and nutrients to the brain pass through the neck, and when posture deteriorates, these pathways are bent, irritated, or partially restricted. The result is not always dramatic, but it is persistent, showing up as recurring headaches, neck stiffness, and a sense of pressure or heaviness in the head. As posture collapses, the muscles of the neck and shoulders are forced to work continuously to support the head, which weighs roughly as much as a bowling ball. This constant muscular effort leads to tension, inflammation, and reduced blood flow within the muscle tissue itself. Tense muscles compress nearby nerves, amplifying pain signals and creating a feedback loop where discomfort leads to more tension and more tension leads to greater discomfort. Over time, this loop sensitizes the nervous system, making headaches more frequent and more intense even in the absence of obvious triggers. Correcting posture through gentle awareness and movement has immediate and long-term physiological effects. When the spine is lengthened and the head is brought back into alignment over the shoulders, pressure on the cervical arteries decreases. Blood can flow upward to the brain more freely, and venous blood can drain away without obstruction. This balance reduces intracranial pressure and eases the vascular strain that often underlies tension-related headaches. What feels like a simple adjustment in how one stands or sits is in reality a profound restoration of structural harmony. Postural alignment also influences the autonomic nervous system. An upright, open posture signals safety and stability to the brain, reducing sympathetic activation and allowing the parasympathetic system to engage. This shift lowers heart rate and blood pressure, both of which are critical factors in stroke prevention. In contrast, a collapsed posture reinforces stress responses, keeping blood vessels constricted and circulation inefficient. By restoring alignment, the body is reminded of its natural capacity for calm regulation. With consistent attention, improved posture becomes more than a physical correction. It becomes a daily practice of self-awareness. Each moment of alignment reduces unnecessary strain on the vascular and nervous systems, supporting clearer thinking, reduced pain, and healthier blood flow to the brain. Over time, this quiet structural support plays a vital role in protecting brain health and reducing the risks associated with aging without requiring force or exhaustion. Coordinated, low-intensity movement has a profound influence on the nervous system, especially in later life when the body becomes more sensitive to stress and overstimulation. As people age, the balance between the sympathetic and parasympathetic branches of the nervous system often shifts toward constant alertness. This state keeps muscles subtly tense, blood vessels slightly constricted, and stress hormones circulating at higher levels even during rest. Over time, this internal pressure contributes to headaches, elevated blood pressure, inflammation, and an increased risk of stroke. Gentle, rhythmic movement interrupts this pattern by offering the nervous system a signal of safety rather than threat. When movement is slow and coordinated with breath, the brain interprets it differently from intense exercise. Instead of triggering a fight or flight response, it activates neural pathways associated with calm focus and control. This type of movement stimulates the vagus nerve, which plays a central role in regulating heart rate, digestion, and vascular tone. As vagal activity increases, heart rate variability improves, blood pressure stabilizes, and blood vessels relax. These physiological changes directly reduce the likelihood of vascular spasms and sudden pressure surges that can lead to headaches or more serious cerebrovascular events. Low-intensity movement also influences neuroplasticity, the brain's ability to adapt and reorganize itself. Coordinated actions that involve balance, timing, and awareness keep neural circuits engaged and responsive. This ongoing stimulation strengthens communication between the brain and the body, supporting faster recovery from stress and improving overall resilience. In older adults, maintaining this adaptability is essential because it protects against the rigid neural patterns associated with chronic pain, anxiety, and cognitive decline. Another often overlooked benefit of gentle movement is its effect on inflammation. Chronic low-grade inflammation is a known contributor to both headache disorders and stroke risk. Calm, consistent activity helps regulate immune responses by reducing stress hormones that exacerbate inflammatory processes. As inflammation decreases, blood vessels become less reactive and more stable, improving circulation to the brain. This stability creates an internal environment where pain signals are less likely to be amplified and vascular events are less likely to occur. Perhaps the most important aspect of this approach is the emphasis on consistency over intensity. The nervous system learns through repetition, not force. Daily low-stress movement teaches the body that regulation and recovery are always available. Over time, baseline stress levels decrease, sleep improves, and the nervous system becomes more efficient at returning to balance after challenges. This calm efficiency is one of the most powerful protective factors against headaches and stroke, quietly supporting health through steady, mindful engagement with the body. Practicing a brief 4-minute routine each day may appear modest, yet its impact extends far beyond the physical movements themselves, reshaping how the mind and body relate to aging and health. Consistency sends a powerful message to the nervous system that care is predictable and support is ongoing. This sense of reliability reduces unconscious stress, allowing physiological systems to function with greater efficiency. When the body expects regular moments of gentle regulation, it becomes less reactive to daily pressures, and this calm expectation alone contributes to lower blood pressure, reduced muscle tension, and fewer stress-related headaches. Over time, this daily practice strengthens self-regulation, the body's innate ability to maintain balance without external intervention. Instead of relying solely on medications or reactive solutions, the individual becomes an active participant in their own well-being. This shift has measurable biological effects. Studies in behavioral health and cardiovascular medicine show that individuals who believe they can influence their health outcomes experience improved autonomic balance, better heart rate variability, and lower levels of inflammatory markers. The mind's perception of control is translated directly into physiological resilience. Sleep quality often improves as a result of this routine. Gentle daily movement helps synchronize circadian rhythms and reduces evening cortisol levels, making it easier for the brain to enter restorative sleep cycles. During deep sleep, the brain clears metabolic waste and repairs neural tissue, processes that are essential for preventing headaches and protecting against stroke. When sleep becomes more consistent and refreshing, daytime cognitive clarity improves and the nervous system becomes less prone to overreaction. Metabolic balance is another quiet benefit. Regular low-intensity movement enhances insulin sensitivity and supports stable blood sugar levels, reducing vascular stress and inflammation. These metabolic improvements protect the delicate lining of blood vessels and reduce the likelihood of sudden pressure changes. Over months and years, such stability plays a critical role in maintaining brain and heart health without requiring dramatic lifestyle overhauls. Perhaps most transformative is the psychological effect of honoring the body daily. This practice fosters a sense of respect rather than fear toward aging. Instead of viewing the body as fragile or failing, it is seen as responsive and capable of adaptation. This mindset reduces anxiety, which in turn lowers stress-related vascular strain. The routine becomes a quiet ritual of trust, reinforcing the belief that small, thoughtful actions performed consistently can support longevity, clarity, and strength well into later life.